early 2000s, before the internet became real prevalent, the primary way that physicians were obtaining new patient referrals, and I was part of a public company at this point, was from other physicians. And what I realized in interacting with some of those physicians, originally I started out as the head of a neurophysiological intraoperative monitoring company. And it came down to communication, which I think in any good relationship, that's the key.
Hello, everyone. Welcome to the podcast where we explore how leaders are reshaping healthcare at the intersection of using technology and patient care. Here, I'm your host, Drupal Patel, and I'm delightfully introduce today's guest for our podcast, Dave Bowen, CEO of Valet Health. Dave has 30 years of experience leading innovation across healthcare, from medical equipment and surgical center to digital marketing and patient engagement technology. So Dave, welcome. It's great to have you here on. You have spent over 30 years, almost 3 decades, right, in the healthcare. But before we get into that detail, what's something about your life, outside of your work, if someone or the people might not know from your LinkedIn or from your business profile?
Boy, that's a great question. I think the thing that's happening in my life right now that maybe people wouldn't know is we're expecting our first grandchild. So
Perfect. Congrats.
Yes, she's
Very
due
happy.
January 29th, and so we're really excited about that. It's a new change for us.
Perfect. So now you'll have a busy, apart from your business, you'll have some personal busy. It's great. The healthcare in such a demanding field, right? What do you do outside of your work to recharge yourself or to keep perspective? Apart from day to day or business routine or, some other routine, the professional routine. What is your outside of work to recharge?
That's great. A lot of things that I do, I start my day every day reading the Bible and understanding the Word. That
Great.
recharges you, puts you in the right mind frame for how do you approach your interactions with others. And then
Right.
what I do throughout the day or in between days, if I don't have the chance during the day, is try to get outside. In my role as an executive of a technology company,
Right.
a lot of my work is done what we're doing here in front of a computer on a video call, interacting with folks. But
Right.
you need that break mentally to get outside. Of course, I have to be careful with the sun, but to get
Mhm.
outside and enjoy a little bit of a break, taking a walk, maybe even cutting my daughter's yard, something simple just to break my routine so that I'm not thinking 100% about the task at hand. And then it always
Right.
gives you a fresh perspective when you come back, you sit down in front of your computer and
Right.
restart. That is always a positive thing for me.
Oh, great. Awesome. Great to know that. Why you choose healthcare as your professional, or innovating something in the healthcare industry.
I started in the early 90s, the mid 90s actually, in durable medical equipment and
Mhm.
orthotics and prosthetics. And what got me really excited about healthcare was the first time I went with a guy named Travis Anderson, who was an
Mhm.
amputee, and we went to fit a patient for their prosthetic leg. And to see that patient's excitement,
Mhm.
relief to walk for the first time after losing their leg to
Mhm.
diabetes really was moving for me. So that led me on a career of trying to do something that impacts others in a positive way. And so that's why I've stayed in healthcare, is to try to be helpful and make a difference in other people's lives.
And that is the good positive way to think, always, support or help to community, to people. Great to hear that. So in your experience or in your career, when you look back, what is the pivotal moment, that really shaped how you think about patient engagement or technology in healthcare?
Back in the early 2000s, before the internet became real prevalent. The primary way that physicians were obtaining new patient referrals, and I was
Mhm.
part of a public company at this point, was from other physicians. And what I realized in interacting with some of those physicians, originally I started out as the head of a neurophysiological intraoperative monitoring company.
Mhm.
And it came down to communication, which I think in any good relationship, that's the key factor. So
Exactly.
what I realized is that in patient engagement or physician engagement, they needed to really do a better job of reaching out after receiving a referral. Now, fast
Wow.
forward today, you can do it much better utilizing technology. But back
Right.
then, that was a pivotal moment of how do we streamline communication between physician to physician,
Mhm.
physician to patient, so
Mhm.
that the patients are always engaged, and that started a path for me of understanding and utilizing technology. Of course, back then it was mostly picking up the phone. Fax machines were really prevalent.
That's true.
Today, very different.
Right. Right. Now we kind of overpassed a lot of things. It's all on phone or it's all on, technology driven things. So
Right.
great. And you've seen this healthcare, evolving dramatically over like last 3 decades. What stands out as the biggest shift you personally witnessed? Like it might be internet, it might be a technology, it might be AI, it might be anything in terms of innovation, right?
I think if you're looking for the biggest shift,
Mm-hmm.
I would say there's two pivotal points I would point to. One is in 2007 when the iPhone came out.
Right.
Um, that put the internet in everyone's hands. Now,
Right.
it was primarily used for business prior to that, so there was a lot of that in healthcare at that point. But then
Right.
fast forward a little bit, specifically when you're talking about internet and utilization, you look at sites like WebMD and now ChatGPT from an AI
Mm-hmm.
perspective. Patients during the COVID period really adopted to utilizing technology to research things on a much higher level. I think that is those 2 points, getting the internet in everyone's hands so you had access to information. So obviously there was a lot of self-diagnosing going on, but now you fast forward with COVID when everybody was locked down, you had no choice but to rely on technology. So it really escalated the utilization of technology. And now with AI, that would be the next key thing. People are utilizing AI to research symptoms or things like that. And that's making for a more educated patient when they're going to see their physicians.
And absolutely, like COVID time, everybody, and not only the healthcare, a lot of other sectors,
Oh, yes.
we saw a lot of innovations and, everybody is now more familiar with the technology, how to use, more educated, like more trained, before they go anywhere. Right. So that actually pivoted very well. Good. So, moving to more about your professional side of insights, can you please tell us about like a little bit about the Valet Health and what's the company mission and who do you serve?
The Valet Health is a patient engagement platform that we've
Hmm.
developed over a number of years now. It's been we're knocking on the door of 10 years,
Right.
and our focus has been in specialty physicians. So physicians who are doing procedures in ambulatory surgical centers, primarily interventional pain management physicians, orthopedic surgeons, folks that are operating in an ambulatory surgical center. We're also uniquely positioned in the Ortho Biologics arena. And we have developed a platform for not only, and it's an ecosystem because there's
Right.
not one silver bullet in the gun for us to say, oh, you do this, and all of a sudden you're going to be first on Google search, which is
Right.
the first question everybody asks, like, how do we get to
That's
number
true.
one? The real answer here is that it is an ecosystem. It's like anything. So it is making sure that the information about you is accurate and up to date on the internet. And
Hmm.
then how do you interact with that information on a regular basis? Blog posts, regular reviews,
That's
because you
true.
have to become very relevant in this community of healthcare. So we're serving really now three. Primarily, we've been focused on the physicians and the patients and improving the engagement between those two. But
Mm-hmm.
because we're so focused on the physicians who are doing procedures, we're also now, you can loop in that manufacturer component as well. So we're working really
Right.
closely with manufacturers of various procedures to help educate, whether it's pre and post procedure instructions, identifying patients for procedures that could help with their pain or their condition. So those are some of the things that our platform has been built for. So I would say Valet Health's focus is patient engagement and extending, utilizing OnDoc AI has developed an avatar
Mm-hmm.
platform that is really important. And we work with Abide, which is a HIPAA compliant platform because everything in healthcare has to be HIPAA compliant.
HIPAA compliant, and
Yes,
that is your wing. That's
yes.
your yes.
Yes. And so everything we do is really centered around that. And we've been very
Right.
fortunate to be partnered with leaders in the industry like Dr. Manchakanti from
Mm-hmm.
ASIP, which is the largest interventional pain management society in the country. And so they really have bought into how do we improve or extend our providers
Mm-hmm.
beyond the four walls of their practice. And utilizing technology, we're taking a very innovative approach to do that, and the results are phenomenal.
Good, good, good. Means I'm really kind of overwhelmed with, the Valet Health, the going in in this direction where it's not help only the patients or physician, but as a whole healthcare, we are innovating something. So really good. So, and I heard about the avatar. So my next question is like, you have been pioneering like physician avatar and patient engagement technology. What makes this approach different from other solution out there?
Personalization. So think about
Okay.
how somebody you have a relationship with, a meaningful relationship, somebody you trust, that's your physician. So when you
Hmm.
hear something from a salesperson or a manufacturer, or you get a piece of paper explaining something to you, it
Right.
has an entirely different impact when it's your doctor saying, Dave, after your surgery, here's what you can expect. And it gives
Yes.
you a level of trust. And it also gives, there's some credibility to what's being said because it's being said by your doctor. And you know that
Right.
that message is approved by your doctor if you're receiving it. So I think those things are the big differentiators is the trust, the credibility, and then the connection. That empathetic feeling you get when your physician is speaking to you versus, someone else.
Right. And those are the, I would say, like a major three key pillars that you might argue covered in your solution. And I think that makes you or your company kind of a stand out other solutions in the market, right? So that's really good. So is there any favorite before and after story that you can share with us here where you saw patient engagement tech really change the patient experience or ease burden on staff? Like, is there a way we are saving any administrative burdens, whether it's on the nurses or on the hospitals or on our as a whole healthcare?
Absolutely. There's a bunch of them, so I'll
Hmm.
pare it down to just a couple. Number
Okay.
one, I started out saying that your information has to be accurate and correct online. So when a patient goes to visit
Obviously.
something about you, they're seeing something about you and not something someone else has posted. So a lot of these sites, whether it's Facebook, Google, they can spin up these profiles. We had one client, and I won't name the client, but we had one client when we showed them their profile, it actually looked nothing like him. He's a tall,
Wow.
very clean cut guy, and
Hmm.
it was a heavier set person with a great big beard, and they were
Yeah.
standing in front of some those row storage places. And this was the doctor's profile. And when he saw
Wow.
it, he's like, "Oh, how'd that get there?" But that's the internet. So when we corrected that information, that really improved his visibility because now it's consistent, credible, accurate information about the physician. In addition to that, one of the things our platform does is that we integrate and we receive information from each of our practices where we can actually request reviews. This is a big thing in healthcare. Patients want to know how other patients are talking about providers. So a
True.
success story is when you don't ask a patient, the only ones primarily, for the most part, will
Right.
go out and leave a review are the ones who had a negative experience. So we implemented about 2 years ago a new platform as part of our overall ecosystem
Hmm.
to request reviews post patient visit. What we found is that one practice they've been in practice for over 20 years. And they probably over the 20 years, I don't have the exact numbers, but this is a little bit,
Okay.
I could get them, but this will give you an anecdotal type feeling. They went from a 4.0 in or 3.7 to 4.0 review rating with maybe 45, 50 reviews to now today they're at 574 five-star reviews and they're at a 4.9
Wow.
rating. And so just by, again, engaging your patients,
Hmm.
that's a win. And the last story I'll tell you is about the avatar side of things. We launched with a company called Viadisc. It's Vivex is the manufacturer, Viadisc is the
Hmm.
procedure. And we launched with a practice in Texas
Okay.
for a beta test. And so we sent patient education about this new procedure
Hmm.
that's available for a back pain. Um, and one of our doctors called so excited because the patient came in and they were so impressed with that they thought the doctor had done the video for them
All that.
specifically. But because it was
Right.
her explaining the
Hmm.
procedure that was pertinent to that patient's condition. I think why is that so exciting? Because now we can identify based on patients' um, whether it's their diagnosis codes, what their
Right.
history is, what's worked, what hasn't worked, you can narrow it down and say, okay, maybe there's some new innovative things happening because
Hmm.
healthcare is always evolving. It's never
Right.
stagnant. So
Exactly.
when you're looking at new procedures like this, Viadisc is an innovative procedure that really does make a big difference in the majority of the patients who receive it. So she had been suffering with this pain and she now felt like, wow, I've got something that's it's at least that's potentially going to help me. And my doctor thought about me. And it was utilizing the avatar in communicating that message. And so that's where the win is when patients can feel comfortable and confident to learn about something. And it may not be the thing that works for her. She may have went
Right.
in and it be a different procedure, but now the patient's engaged. And that's what physicians want. And that's what patients want. The more interaction that you can have, meaningful interaction between the physician and the patient, the better outcome you're going to have.
And that's really awesome because that's exactly what I was thinking when you explaining. My doctor, like I interact not much because, it's hard to reach out to your doctor when you're in need. But like maybe I wish my doctor might use the avatar to have interaction, to feel comfortable, confidence, and whatever purpose is. But I think I'm really looking forward to be implemented, across the healthcare. So it's really good. What surprised you most about the patients are responding this technology? Means I heard that it's on the beta testing. It's not like a widely open to all, patients or healthcare. So is it something you can give us some insight on?
I think the most surprising statistic that I've seen so far, there's two of them,
Hmm.
and that is the level of engagement. So when you think about technology and statistics,
Hmm.
it's about engagement, how a patient or anybody, if you see an ad, how many clicks do you get, all those kinds of things.
Exactly.
The high rate of actual interaction with the avatars, and when someone clicks on the avatar, the high percentage of patients who watch the entire video. Now, most of these
Wow.
videos are anywhere from 45 seconds to 2 minutes. So it's not a
Hmm.
long video, but the patients are engaged, and it's a very high percentage. I have statistics that I just received them last night, actually, on three of the
Good.
beta tests. One's for RFA, one is for
Hmm.
Viadisc, and one's for a procedure called Intracept. What we're
Okay.
seeing is that patients are actually, when they start the video, and we'll use Viadisc as an example, 43% of patients who have received the text message explaining that this could be a potential benefit to them,
Hmm.
43% of them are starting the video, and over 90% of them are finishing the video.
That's a great way. That is, we talk about more on your Valet Health company and then what it does, what is the mission, what are the things in the pipeline and things like that. So let's move on. And I'm just checking in my questions to make sure I'll capture those. Uh, every innovation journey comes with its hurdle, right? When you start this project, start with this innovation, maybe it's an avatar or patient engagement. What you have found most challenging as you try to scale this solution, whether it could be adoption or compliance, maybe HIPAA, right? Or educating patients or physician itself. What are the challenges that you faced?
I would say the number one challenge is that healthcare is very innovative when it
Hmm.
comes to providing care, when it
Okay.
comes to providing communication, when it
Hmm.
comes to providing technology to the patient side of things. If you think back to when uh, EHRs had to be implemented, the
Right.
government actually had to incentivize. They had incentivized physician practices and hospitals to adopt an EHR system. So to go from
Remember that.
paper to paperless. It's still conceptual. So even though healthcare is very innovative in a lot of ways, they're behind the times in how you engage people to learn about your services. So if you think about Amazon and all of these other retailers that are reaching out, we're getting inundated with text messages about the next cowboy boots that just came out or the next shirt or the from a
Right.
healthcare perspective, they've always been a little bit apprehensive. And HIP has been part of that. So
Right.
partnering with a company like Abide has really helped us escalate and move things forward quickly because we are being HIPAA compliant. We're making sure that the practice is getting the documentation that the patient is willing to receive that information. So,
Hmm.
but that's the number one challenge is physicians understanding that the way patients interact today
Hmm.
over there's all different statistics out there and all different studies, but one that sticks out to me is a study that over 95% of patients, even when they're referred to another physician by a physician, they still go online and Google that physician. It's really important to understand, yeah, you're getting referrals from other physicians, but the patient is still going out and looking at your digital presence to see what are other patients saying about you? What makes you credible? Are you an authority in the space that you're in, whether it's spine surgery, knee surgery? Are you putting content out that is educational to the community? And those are the things that we're continuing to work with societies and large physician practices and trying to help them to understand. These are things that are really important. And think about this, we've got an elderly population. Now everybody has a smartphone today, right? This next generations that's coming behind them,
Hmm.
all they know is digital.
That's true.
So
No
if
more
you're not
papers,
on
no
board with
more
that
phone
stuff going
calls.
forward, yeah,
Yes.
it's going to be a problem.
Right, right. Okay. No, good to know. Always there would be a challenge when you try to innovate something or scale up your business, but this is really good. So looking ahead, like from now, like ahead 6 to 12 months or a year or two, right? What would feel like a big win for you and Valet Health?
I think for Valley Health, a great win would be to be able to educate the healthcare community on the
Mm-hmm.
importance of empathetic interactions and engagement with their patient population in between visits. So that means I've seen my physician, I get a follow up, and it's the avatar being delivered by technology to me so that I can view it on my terms, not a
Mm-hmm.
phone call from the nurse when she's got the
Right,
last 2 hours of the day and she's dialing for dollars. But I get the ability to receive that text message with that avatar explaining to me what to expect in between visits. Or in some cases, maybe it's a new program that the practice is. But I
right.
think a major win is to see that our technology that we've partnered with OnDoc AI with partnered with Autopilot Plus, which is Valet
Hmm.
Health's platform. So we're the delivery mechanism. They
Hmm.
develop the actual avatar. So to see that become more prevalent, especially in pre and post procedural conditions, where you're getting your pre procedure instructions from
Right.
your physician, and you're getting your post procedure instructions from your physician. And it's not going to be 100%, but what we can do, you mentioned it earlier, cutting down on staff time. My doctor, after every surgery, has to, one of her staff members calls me. They hand me a white piece of paper, and I say to her every time I'm in there, what if you could text me and I could watch a video about what to expect? Because
Right.
that white piece of paper goes right in the trash. The nurse may
Exactly.
call me at a time I can answer, may not, and they leave a
Right.
message. I may not be able to call them back regular business hours. So it's a little bit of phone tag. If we are able to do what we're doing today and
Mhm.
implement a system where you receive the text message, we can tell that you opened the text message, we can tell that you've watched the video, we can tell how much of the video you watched, and you have an acknowledgement on that you've actually engaged with the video. Now that nurse can put that in your chart. If you have any questions, you have a click to call button right on there. So if any questions arise, the patient has the ability to do it at their convenience. And I think that would be a huge win because we live in a society today, everything is about convenience.
Exactly. And maybe it would be helpful if we are not focusing on specific area. Means I know you, yeah, I think I heard earlier like only the orthopedic, that may be your, specific area, but maybe we can expand to,
Right.
right. So that
Yeah,
that would
and I
be
think for
awesome.
us, the natural progression, there's a large percentage, and there's been a shift over the last, decade
Hmm.
plus of going from getting procedures done in a hospital setting versus getting them done in an outpatient ambulatory surgical center setting. Our focus has been on the private practitioners that are operating in the ambulatory surgical center setting. So it is a lot of different specialties. There's
Right.
urology, there's gastro, there's so many
So
different
many.
specialties that
Right.
there's so many different specialties that are doing procedures in a surgery center versus
Hmm.
at a hospital. That's where our sweet spot is for phase one. I think this benefits hospitals as well
Hmm.
dramatically, but they're definitely slower adopters than a private practitioner.
Exactly. Right. Right. I agree. This question, it's my favorite, and I usually ask this question to my wife. If you could wave a magic wand, solve one friction point in healthcare engagement tech, what would it be?
That is a really good question. One friction point. I think it goes back to the in between office visits
Hmm.
because I think there's some reality to the white coat mentality of when you're with your doctor, you're hearing about 50% of what they're saying. Even though you're
Right.
trying to pay attention, there's a little of an intimidation factor there. And I think especially for the elderly population. So that would be my one wand to wave is better communication in between visits because physicians, there's a shortage of physicians,
Right.
there's a shortage of nurses, and
Right.
so you have a shorter amount of time. It's not like back in the 80s when you get 45 minutes with your doctor.
Correct.
Average office visit is 10, 12 minutes, maybe.
Hmm.
Um, so that would be it, is that to better deliver educational information pertinent to patients and their conditions in between office visits.
Yeah, I think that is really good. Actually, when you asked me a lot of things to, in the innovative way, but maybe we can talk offline. But good to know. For leaders listening who wants to responsibly adopt this AI in healthcare or in their healthcare business or clinical business, what's your one piece of advice to them?
Don't look at AI as a replacement.
Hmm.
Look at AI as an extension, as a tool.
Okay.
I think there's too much discussion out there about robots and about this and about that and replacing people and people losing their jobs. I think that AI is an enhancement, an extension. It gives you access to more detailed and pertinent information when you're utilizing it. but it is not a replacement, especially in healthcare, because it can make mistakes. You
Right.
need that human portion. You need that portion to make sure what you're sending out to patients. So I would say don't rely on it. Utilize it as a tool.
I like that response because I was reading some blog from one of the physician. Like we notice every time nowadays, not the elderly, like the new generation, when they come, they know the problem and they always do a chat GPT or use AI and then say, this is a problem and I did this thing. Do I need to do further? In the room, with the doctor, I think you shouldn't be asking those questions because you always need a human touch.
In addition to that, I think it's important that there's so many, you're putting words on a paper. The chat GPT or Perplexity or Gemini or whatever AI you're utilizing does
Right.
not understand all your comorbidities, don't understand all
Exactly.
the medications you're on. And you can list all those things, but how
Uh-huh.
everybody metabolizes medication differently. Your physician knows that. They understand how you're impacted by different dosages, whereas
Right.
AI does not. So I think it's
That's not.
okay to utilize AI as to look and see, hey, I've got this pain in my knee. What could it potentially be? And
Mhm.
I don't think there's anything wrong with sharing what you feel with your doctor, but I think letting your doctor make that determination is going to be really important.
Exactly. Has been such a valuable conversation. Where can the listener learn more about you or about your company, Valet Health?
They can go to valethealth.com. That's our
Mm-hmm.
website. That's probably the best place to start. Or if
Mm-hmm.
you wanted to search me on LinkedIn, you can certainly find me there. And I try my best to be responsive. I try to
Okay.
weed out the robots versus the real humans who are reaching out to me, like we've
Right.
discussed in the past. But yeah, both of those places would be a great place to start.
Amazing. Thank you. Thank you so much again, Dave, for sharing your insight, your journey, your story. And for our audience, if you enjoyed today's episode, today's podcast, please subscribe for more conversation with innovators shaping the future of healthcare. And we are signing off.
Thank you so
Thank
much. I
you.
really appreciate the opportunity.
Thank you.